work for the NHS. You've had a great idea, you've made it happen, and it's made a big difference to how we can learn from COVID-19 and enter a new normal. Ideas like yours drive improvement and they deserve to be shared. That's what Bob does. Amplifying good ideas like yours across the NHS so as many people as possible can learn from, adapt and implement your idea. The further good ideas are shared by the Bob community who learn from them, the greater improvement we can achieve.
But actually, I think through these discussions, we might discover that it's not so dissimilar after all. So to kick us off, we're going to hear from the two key industry bodies from Pharma and Tech. But before we do that, I just want to find out who we have in the audience. So you should be able to see, if you click on the polls tab, there should be a tab there asking what organisation you're joining us from. So if you could just select the answer, or if you don't have the appropriate answer, just pop in the chat where you're joining from. So while we're finding out who you are, let's find out who our speakers are. So I'd like to hand over now to Carolyn from the Association of the British Pharmaceutical Industry, who's going to tell us a little bit more about the organisation. And then she's going to hand over to Luella to tell us about the ABHI.
Okay, thanks, Chloe, and hello everybody. It's really great to be here. I'm Carolyn Heaney. I'm NHS Engagement Policy Partner at the Association of the British Pharmaceutical Industry. Now, the ABPI represents companies of all sizes who invest in discovering the medicines and vaccines of the future. We exist to make the UK the best place in the world to research and develop the use of and use new medicines and vaccines. To do this, we build on we focus on building a thriving environment for medicines discovery so that the UK is the best place in the world to research and develop new medicines and vaccines. We focus on improving access to new medicines and vaccines so that everyone in the UK can benefit from the latest treatments, and along with enhancing our industry's reputation by demonstrating the high ethical standards we set for ourselves and that society expects. To do that, we are governed by the ABPI Code of Practice. So the industry is self-regulated, and the Code of Practice is a visible sign of our industry's commitment to benefiting patients by operating in a professional, ethical and transparent manner. What the code does is set standards for the promotion of medicines to health professionals and other relevant decision makers in the UK, and it covers interactions between industry and health professionals. It also sets standards relating to the provision of information about prescription-only medicines to the public and patients, and covers pharmaceutical industries, pharmaceutical companies' relationships with patient organisations. Finally, we represent our members using their insight and experience to communicate how medicines change the lives of millions of people every day. And I work within the NHS engagement team at ABPI, and our role is to support adoption of innovative medicines by acting as a catalyst for partnership working between the life sciences sector and NHS systems. So to do that, we are involved in doing is enabling, raising awareness of and showcasing collaboration across the system to support shared goals. We play a role in sharing best practice about how to work in partnership, and in driving awareness of the different approaches to governance to enable the sort of collaboration that we believe is most productive. And we also build networks with NHS organisations and leaders and surface the priorities where industry can make a difference, all hopefully with a view to maximising the opportunities that we truly believe that exist from working in partnership in order to embed in innovation in healthcare. So on that note, I will hand over to Luella.
Thank you very much, Carolyn. I apologise for some slight background noise. As is working from home, noises happen in your garden without your choice. But anyway, I am Luella Trickett, the Director of Value and Access at the Association of British HealthTech Industries. We're the leading trade association representing medical technologies, diagnostics and digital. We have about 300 members, of which 90% are SMEs, and that figure is very reflective of the industry as a whole, heavily dominated by SMEs. However, we do also have very large multinational companies in our membership, and some of those are represented here today, and you'll be hearing from them. We do a range of activities on behalf of the industry, and very much like Carolyn, we are representing and upholding the reputation of the industry. At this particular point in time, as I'm sure you can imagine, we're doing a lot of work around regulation, what the world's going to look like when we leave the transition period at the end of December. My personal role in the organisation is to champion the adoption and spread of innovation, and ultimately how that is procured by the NHS. One of our big focus areas is on value-based healthcare, really looking at healthcare from the point of view of the patient and looking to deliver outcomes that matter to the patient and to the system. What we're going to be talking about today is very much at the heart of what I'm interested in. Many of you will be aware that at the moment we have the NICE methods and process review underway. That is going to be an integral part of what the future looks like for medical technologies, diagnostics and digital. And coupled with everything that's going on in the COVID world at the moment, I think we've all seen the transformation that can happen. And at that point, I will hand back to Chloé.
So we've got a few different people joining us. The poll doesn't seem to be live, but we've got some Emma from RW Consulting. We've got a couple of other people joining there. So welcome. So obviously, thank you, Carolyn and Luella, for introducing the ABPI and the ABHI. So I'd now like to hand over to our panel members to introduce themselves, kicking off with Dawn.
Hi, everybody. Good morning. My name's Dawn Tretton. I am Head of Policy and Partnerships at Boehringer Ingelheim.
Morning, everybody. My name's Michelle Sullivan. I head up the Market Access and Health Economics team at Boston Scientific.
Good morning, everyone. My name is Andrew Riley, and I am an Area Healthcare Lead for MSD UK. Apologies, I think I went out of order there.
No problem at all. Good morning, everybody. I'm Craig Mustoe. I am the Market Access and Government Affairs Manager for Baxter Healthcare.
Brilliant. Thank you very much, everyone. So kicking off into the actual panel discussion now, Luella, obviously you mentioned COVID, and it's hard to ignore COVID, even though everyone might be a bit sick of hearing about it. But obviously it has had an incredible impact on the adoption of new technologies. And so first off, to just sort of kick us off, Andrew, I'd just like to unpack sort of what your reflections are from this experience.
Thank you. So, morning, everyone. I think we've seen during the pandemic, both at a very local level and a national level, the way that the medtech industry and pharmaceutical industry has responded and supported the NHS. So at a national level, that was guaranteeing the supply of medicines during the pandemic, so there weren't any shortages. And at a local level, there were partnerships. And I think for me, it was that agility that was demonstrated by the medtech industry and by pharmaceutical companies to respond to very rapidly to a new need, unprecedented need within the NHS, almost to change tack and think, actually, okay, what we were doing 6 months ago, what we were offering 6 months ago probably isn't relevant now. And actually, what new support and new help can we provide, such as getting information out to patients about the new COVID restrictions, about new COVID principles and procedures. I think all the companies demonstrated that, both within tech and with innovation. I suppose that agility was the thing that really, on reflection, is the thing that I observed the most.
Thank you, Andrew. And I know, Michelle, you've got some big thoughts on sort of how collaboration has improved during the pandemic as well. So can you tell us a little bit more about what the positives have been from your experience?
Yes, pulling positives from COVID, there's a thought. So moving on from the agility piece, which I completely agree with you, Andrew. The other piece that was so apparent to everybody and is still going on is collaboration, and collaboration in all sorts of different ways. We have very direct and immediate requests all of the time with med devices when we're working in hospitals and supporting teams and supporting cases. And what happened with COVID was we were unable to meet some of those immediate requests in the same way that we needed to. And we had to find ways of collaborating with our customers, of collaborating with other device companies, of collaborating with procurement, of collaborating with those that were running the hospital, and of collaborating within ABHI actually, to come up with wonderful and magical ways that we could help support and serve our customers. Some of the things that we got involved with at Boston Scientific were such things as virtual reality apps, being able to support cases in real time virtually, even with very close work. And what this built was a collaborative, we're all in it together approach that personally, and having discussed this, via various groups at ABHI with my colleagues, we're all keen to continue. And we've heard many different parts of the NHS say thank you for us quickly and speedily supporting them in innovative ways. And we are keen to continue collaborating in that way and with each other also.
Great, thanks, Michelle. It sounds like you've been doing some fantastic work. So obviously that's from a sort of med tech perspective. So Dawn, I'd just like to turn to you to kind of find out a little bit more about the ways that, from a pharma perspective, how that collaboration is being approached.
Yeah, so I think one of the great qualities of the pharma industry is our ability to be able to connect systems. So whether we can connect north with south, east and west, and actually drive better conversations between the NHS. It's an incredibly busy time, and actually there isn't always the opportunity to reach out and search for best practice. So it's a real quality, like I say, of working through the ABPI as a collaborative, but also as individual organisations to be able to do this. And we've seen some great examples around pathway changes, particularly in respiratory, where we've been able to connect systems, and this goes across all therapy areas. But I think the other piece we can do as well locally is also connect different parts of the systems. So across, there'll be multi industry collaboration opportunities, and we're all able to work together. And actually, the NHS is now starting to come. Carolyn may talk to this later, but is actually starting to approach the ABPI because they see these qualities, they see the ability of pharma to connect systems and share best practice, but actually bring probably different qualities, a different viewpoint to support their challenges. So for me, that's probably an untapped resource, an untapped opportunity, but we're starting to see some real green shoots of acceleration and opportunity.
Thanks, Dawn. So that's a nice segue into kind of, you touched there on kind of pharma's, collaboration with the NHS and sort of the broader systems approach. So I'd like to turn to Craig and ask, what are your thoughts on kind of how industry currently kind of works to improve the system and introduce new technologies?
Thanks very much. And yeah, there's already been a number of very relevant comments made that I think are going to be a theme throughout this, particularly relating to collaboration and the need to be relevant. So I think a lot of this comes down to really understanding the problem that you're trying to solve and why you're trying to solve it, why it needs solving. And I think part of the challenge that we often face is the term technology or innovation adoption, and that I think has led to primarily a focus on the technology itself. And I think what we need to do is start looking beyond that technology at how we can help deliver greater benefits to both the patient and the system as a whole. And the challenge with medtech is often used in small parts of very large, very complex treatment pathways where you have multiple influencing variables. So we need to start to consider, what do we bring as an organisation to care delivery, rather than just thinking about the impact of the use of a piece of technology at a discrete point in a care pathway. So if we do that, what we can do is start repositioning the conversation towards something that's more solution focused rather than transactional. And I'm going to try and make the point with a very simplified example just for illustration. Let's take a technology, for example, which reduces post-operative bleeding in surgery faster than conventional methods. And let's say that that technology takes 5 minutes off a 2-hour operation. So it's quite hard to illustrate the value of that, and it's harder to justify the impact that that'll have on budgets. But if you were to take that outcome and say, okay, well, does that give us the opportunity, because we've reduced post-operative risk, to take that patient through a day case pathway rather than an inpatient stay? There's potentially the chance to send them home earlier. Maybe there's an opportunity to introduce some technology. Maybe there's an app that can help track symptoms at home. And if there's a live feed into the caring physician, then they can make some really quick real-time decisions. So you can start to see how that very simple idea can develop into something that's actually of much greater value than it initially looks. So for me, I think those organizations who are able to really understand the challenges faced by health systems and clearly demonstrate the system value through co-creation of new care models, they're likely to gain more traction than simply developing technological innovation and assessing them as part of a discrete part of an existing pathway.
Thanks, Craig. And leading on to that, and I think you alluded to it earlier, Michelle, but you know, we've seen things rapidly evolve during COVID, and actually focusing on that sort of problem piece. So kind of what are your reflections on how we can keep that momentum going post-COVID?
Well, we've talked about collaboration, we've talked about agility. Craig's given some good examples of looking at the full patient pathway. And through this whole crisis, what I discussed earlier and what is apparent is that we are all working together in new and innovative ways. And not only that, but as has been discussed by the providers and by anybody who's been responding to the situation, we're working in ways that we have never worked before. And so I believe that there can be a level of collaboration towards a common aim of solving some of the big system challenges that have come up because of COVID, which were already there before COVID, but they've been exacerbated enormously, whether that's waiting lists, whether that's workforce challenges and issues, whether that's capacity, whether that's diagnostics and ability to give timely diagnostics. All of these things are part of patient pathways that we could all be working together in new and innovative ways. And that's companies within the med device workspace, that's pharmaceutical companies. We've all got a part to play in the patient pathway and what best practice looks like, and also what best practice looks like in today's world. Okay, you know, what best practice looks like in today's world might be something quite different. We might have things that have moved up the agenda that weren't there before. We all know that we're focusing on keeping patients out of hospital, doing speedier things with them, doing them in settings that are different, making them feel safe and secure in how we're treating them or diagnosing them. And, you know, we're working with a NHS, which is under the cosh and under big capacity and workforce constraints. And we need to be working with them in a very collaborative pathway, supportive way, all together, solving specific problems that have been identified. And that's what we did in COVID. So why can't we do that with some of the other things that have risen to the fore now?
Thank you, Michelle. So I'd like to just welcome Christopher, who's joined us. And so Christopher, if you obviously first introduce yourself, but then if you could answer the question from a pharma perspective, it would just, I know you've got some thoughts on this and sort of the introduction of integrated care systems. So just be good to hear your reflections on how the industry can work together with the NHS better.
Yes, so first of all, apologies that I'm a little bit tardy. I had some challenges with my Wi-Fi router this morning, to put it mildly, but yeah, glad to be with you now. So my views on this are, are fairly fairly straightforward, I think. I mean, I've got some experience in working in industry collaborations with the NHS where it's worked well. I think quite often clinicians are better placed to initiate collaborations with industry than commissioners are, in my experience. And they see the validity of being able to expedite things more quickly within the system through partnering with industry, which strikes me often as ridiculous, that a clinician or a consultant will have a easier route to achieving what he wants for a patient through partnering with somebody out with his own organization than within. And I think that points to, some of the challenges for industry really in engaging with the NHS. I think there's less challenges for industry engaging with the NHS than there is from the NHS engaging with the NHS quite often. And there are a number of anecdotal examples I could share where clinicians have approached commissioners with innovative models of care or pilots that they want to test, where they've defined through looking at data or outcomes a clear opportunity for improvement, but have not managed to garner the support because of competing priorities or over engineered bureaucracy, sometimes, for want of a better phrase, in the commissioning landscape, which has stood in the way of progress. So my personal viewpoint is that the NHS needs to get better at engaging with itself before the relationship with pharma will improve. And point in case, I think we've got PCNs now that are taking responsibility for making clinical decisions on local footprint levels, which is, I think, a great step forward. But they're not recognised as statutory NHS bodies yet. I think probably something that would be useful from a national level for industry engaging would some sort of definition around how industry engage better with PCNs, because up until this point, if we do wish to do that, it's typically through a sort of third-party relationship with the trust, for instance, that will sort of broker that engagement. But that's kind of my viewpoint. Hope that's useful.
Thank you, Christopher. Andrew, I'd just like to turn to you because I know that you've got some quite good examples of how the NHS is actually tackling this approach in a sort of innovative way. So could you share your thoughts on that?
Yeah, no, happy to. So I think it goes back to Craig's point, a really excellent point about focusing on the problem and having a clear idea of what the problem is. So there's been a couple of examples nationally with the Vanguard programs, and then at a regional level where the NHS has used a kind of a governance structure in terms of like an industry challenge. So where they've defined a problem and said, this is the problem, this is our parameters, what's in scope, what's out of scope. We would welcome, almost like a tender basis, we would welcome approaches from industry who have a presence in this market to basically submit proposals that they think would provide solutions towards this larger goal that they've articulated. And again, it's like I say, in the Vanguard program, that led to quite a few companies engaging and delivering large-scale projects. On a regional level, it's led to me being involved in a joint working project. And what I liked about it was it had that equity across all companies. So all companies were able to have the transparency to be able to apply if they wished to. If they didn't want to, they didn't have to. It gave the customer that kind of probity and governance structure that they knew that they were doing something in a transparent and appropriate way. It was all compliant with the ABPI rules and regulations and kind of shaped by their joint working framework, and very much fell within that and was guided by that. And like I say, it's led to successful outcomes in terms of projects that have helped deliver benefits to patients, to the NHS, and to industry, kind of that golden center of the Venn diagram that we're all working towards. So yeah, I think there is examples there that academic health science networks or ICSs in the future can utilize to basically have a framework to with identified opportunities to encourage collaboration, which is Michelle's point, and to keep that going. So yeah, I've had a personal very good experience of that, and I'm happy to share offline more details if people wanted to get in contact.
Thank you, Andrew. And that's a really interesting example. So I'd like to just find out a little bit more from Luella if you've seen a similar thing happen in medtech and health tech, and what your thoughts are on that approach.
Absolutely. I mean, it's almost the core principles of value-based healthcare, actually trying to deliver a solution that is system-wide beneficial. We often talk about the adoption of innovation in the context of something shiny, big, new and expensive, but actually innovation is about changing the way you do things as much as changing what you do those things with. And collaboration that we've all talked about already has to be part of this. And again, reflecting on the COVID experience, there wasn't one silver bullet. You needed diagnostics, you needed therapeutics, you needed medical equipment in intensive care units. You needed all of the people coming together to deliver the treatment plan for the system as a whole. And so I think what we've seen is industry collaborating with industry partners as well, because if you're trying to solve a solution across a pathway, chances are no one single company has all the solutions. We tend to be specialists in our own field. And therefore, if you're a specialist in one bit of the pathway, isn't it better to go and work with another specialist rather than trying to become good overnight? And I think we've seen a lot of that happening. I think the other thing that we need to remember is the NHS prior to COVID was very, very siloed. One of the things that we've seen the change through COVID is the removal of the barriers. And that's removal of the barriers from a financial point of view as much as from a technology point of view. And that is where you're empowered to actually deliver a pathway solution, because you can spend money in one place to benefit another place, which I think all of us collectively agree has been one of the barriers to the adoption of innovation historically. So we've just all proved that it can be done. Let's use this silver lining, this little tiny silver lining, and take it forward. Thanks, Chloe.
Thanks, Luella. And that leads on nicely, actually, you've talked a little bit about what you're doing moving forward and how we can actually keep this momentum going. So Carolyn, I know you've got several things that you're working on moving into 2021 to showcase the value that pharma brings. So would you like to tell us a little bit more about that?
Yes, thanks, Chloe. And this is a really interesting discussion, isn't it? And what's striking me is what Dawn said about the sort of cross-fertilization that pharma companies and medtech companies are able to help with in terms of sharing insight, bringing insight from one area of the system to another, either within a system or across different systems. And what Craig said as well in terms of working within a pathway and sort of just bringing a different perspective, what the external person can bring in terms of the perspective on just a different way to think about things. And there's a huge value in that. And so we really have worked hard to support industry to generate the strategic partnerships, which we believe is the best way to improve outcomes for patients and in the future. And we are constantly building on the thriving agreements that we already have in place, which between our industry, the NHS and other system partners. And ABPI itself has memorandums of understanding with Birmingham and Greater Manchester which are both examples of where we are creating a framework within which pharma companies and NHS systems on a geographical basis can work to improve the health of the populations across that geographical area. We also have a partnership agreement with the AHSN network, through whom we're working in partnership with the network as a whole and with individual AHSNs as a channel for supporting partnership working between pharma companies and NHS organisations across their different patches. And we also have a partnership agreement with the NHS England focused on diabetes to help industry, so that industry can help deliver the goals of the National Diabetes Strategy. And that's just a few examples. We've also recently undertaken an exercise similar to the one that Andrew described around the NCA, but with NHSX, where we facilitated a call to industry from NHSX to support the delivery of services through remote monitoring and remote delivery, and the sorts of things that have emerged as being particularly valuable in the context of the pandemic. So that's the sort of thing that we are doing at national level to support the sort of joining the dots between organisations and supporting the dialogue that is valuable to take place. But the other thing that's key is actually showcasing what is happening between NHS and industry and what the value of it is. So a key thing that we are currently doing is working towards the development of a repository of examples of NHS industry cross-sector collaboration, so that we can build and share information about specific projects that have demonstrable successes and the demonstrable successes and improvements that they have generated. And for the first time, once we have brought that to fruition, it will enable access through a single portal to scores of tangible examples of projects that have been delivered by the NHS and pharmaceutical industry partners across our member companies, demonstrating at organisation and system level how industry can contribute to the delivery of NHS priorities across the UK. And it's all about ultimately delivering a triple win of improved patient outcomes, more efficient use of NHS resources, and evidence of impact of industry. And so we really hope that by bringing people's attention to and sharing quite how much activity is going on in terms of partnership working between pharma and then the NHS, quite how much is going on, and the value that it brings in terms of the benefits that it brings to patients. We're really passionate about that, and are extremely enthusiastic about sharing those examples and working with people to understand how we can help people learn from them.
Thank you, Carolyn. That's great to hear from a sort of national perspective what's happening across the pharma industry. So I'd like to now drill down and come back to Dawn. I know through your career you've seen this big cultural shift in the way that pharma works with the NHS. So just be good to hear a little bit more about your experience and thoughts on that.
Yeah, I won't say how many years I've been in industry because that will definitely give my age away. So I'm not going to do that. But it's true to say, having come from the NHS originally and stepping into pharma, it was a big cultural change. Pharma were the big bad organisations that pumped expensive drugs into a system. But actually now it's really taken a step forward, and I'm genuinely seeing a massive, culture shift in how the NHS wants to work with the industry. There's a genuine need and desire. I think the secondary part to that is really important, to create and co-create solutions that, Andrew touched on it, this triple win. So creating a win for patients, creating a win for the NHS, and actually, quite rightly so, a win for industry, because medicines alone won't solve a challenge, but working together and creating wraparound solutions, whether that's digital, whether that's collaboration with third-party organisations. MedTech, actually, we're starting to see more collaborations there. and some very simple digital solutions are actually starting to come to the fore. So I am definitely seeing a sea change, and I think from an industry perspective, we have to keep driving that co-creation and that triple win conversation, because the value that we can bring, whether it's skills, data analysis, project management, and actually understanding the NHS, working with the NHS, I've already said, to connect systems, is really impactful. And what we're starting to shape now as well is a reduction in health inequalities, because we're supporting the NHS to think differently about how they access patients who wouldn't ordinarily hit the system. So there's been a 30% reduction in activity because of COVID. So there's a lot of work in industry working with the NHS to think about how we can reach out to those patients. So that requires a different type of thinking. That, we're talking social prescribing, we're talking risk stratification. It's beyond the medicines. And I credit to industry for thinking outside the box and doing things in a very different way, but also credit to the NHS for actually really taking on the partnership approach and wanting to work with us. So I see a really positive future, and unfortunately for many, COVID has accelerated this, but it's just shown how we can work effectively together.
Thanks, Dawn. Some really interesting points there. Craig, from a medtech perspective, what have you seen in terms of working together with the NHS in this different way?
Yeah, I think a lot of the challenges are actually fairly similar. I mean, it was a really interesting point there that Dawn made about looking beyond the drug, and as I said before, I think it's very good for medtech as well. But I want to come back to the point that Luella made around nice, new, shiny things and the way that healthcare is procured, because I think these two things are potential barriers, and I think things are starting to change. So value doesn't necessarily need new, exciting, high-tech innovation. I think that's the sort of first point I want to make. I think payment by results has created a bit of a challenge whereby activity drives income. So decisions made around technologies often focus on reducing cost versus a set tariff, rather than necessarily looking at the net impact, the net value impact on the system. So I think as the payment system starts to change, and we're expecting that to happen, we're expecting it to go more towards a blended payment model over the next 12 months. And as integrated care systems start to develop, I think there's going to need to be a much clearer understanding of the cost of delivery of care within a defined financial envelope. So understanding the net impact that a technology can bring is going to become really important. And I'm going to give another example, just to try and illustrate this. So the example is it's a combination of medicines and medtech. Currently, there are around 40 million doses of IV infusions prepared aseptically on wards each year from drug vials. And the time taken to do that is estimated at around 4,000 whole-time equivalent nurses just in England. And this is at a point in time when there's obviously fairly serious constraints on the NHS workforce. So if you could introduce a licensed, sterile, ready-to-administer version of those doses in a bag or in a syringe ready for IV administration, that can have a really significant impact on patient safety and in freeing up time for care. But because we're talking about effectively a generic drug rather than, say, a new active substance, it's likely to fall through the cracks of any kind of formal health tech assessment process, and therefore miss out, for example, on things like funding mandates. And therefore it's unlikely to be assessed based on its value, and it's most likely to be seen as a cost, and the cost of procuring it is likely to be more than the perceived cost of administering it, on the wards. So as a result of that, I think organizations may not have the appetite to develop those kinds of products if that pathway of adoption isn't there, even though such a simple, in inverted commas, product could solve quite a substantial issue. So I think any value-based healthcare system should be able to really understand and extract the value from that product, and then apply applicable funding to that, so that something so simple can actually be quite transformative. And I think to do that, I think as an industry, I think we need to be better at illustrating that value and articulating the value. I think the NHS needs to be better at procuring value. But I do think that because new integrated care systems are developing, because of the way that funding and reimbursement looks to be changing, I do think there's a genuine opportunity to do that, to look beyond the drugs, beyond the technology, and to think, as Luella said, about innovation as more than just the technology itself. It's about what it can deliver and how it can solve problems. And I do agree with Dawn as well that I think there are improvements. This has been a conversation we've been having in the industry and in the NHS for a long time. But I do think that there are some chinks of light that do suggest some improvements going forward.
Thanks very much, Craig. Some really good points there. Now, very quickly, I've just got one more question for Christopher, but I'll ask you to be snappy because we want to be able to answer some of our attendees' questions. But I just want to ask your thoughts on how we can actually work to build a better value story. I know you've got some thoughts on this around modelling and things, so it'd just be good to hear your perspectives.
Trying to come off mute. There we go. Thank you. Yeah. Yes, I do. So I think sort of reflect on industry a little bit and our approach. Quite often we're marketing led. Quite often we're very brand led as well. And we focus quite heavily on messaging around that. And I think industry needs to progress beyond the pill, I think is the kind of quote that gets banded around a bit. But what that actually means for me, you know, if you think, I used to work in consulting environment, what we used to talk about was approaching any problem in sort of cyclical fashion. So you'd sense the problem, you'd then go out and seize the problem, and then you transform and you'd revisit and you continue that sense, seize, transform loop. In pharmaceuticals, we jump straight to the end very often. So we'll go straight to seize and transform, to use that analogy. Whereas what we should really be doing is thinking about sensing the full holistic environment, you know, out of a particular pathway of which our medicine is only one component or one treatment of probably a myriad that a patient on in that pathway will be on. What other factors influence them? You know, is it their ability to take the medicines, or their compliance, or their attitudes, or education? You know, are there bottlenecks in the system that analysis or data can point to that they don't get, patients don't get appropriate or timely review? You know, can we shine a light on that sort of stuff that allows for a broader, more MDT type discussion across a health economy, and can lead to more, I guess, sustainable probably and impactful changes that don't just look at one small part. And I think it's on industry. We've got a lot of capable people, and we've got a lot of experience in analytics, but I think it's on industry to kind of take that on and yield it in anger better to try and drive results that are focused on the full health economy.
Thanks, Christopher. So we've literally got 1 minute left. I'm going to come back to Michelle and ask, had a question from the audience saying, what do you think is the key driver for successful collaborative work?
It's going to be a real basic, but it's communication and building a network and thinking laterally and outside of the box. And we all do this in our industries, right? We all have started in various different places. You know, I started as a sales rep, and what I had to do was go in to operating theatres and build relationships with the team that I'm working with, and then come up with ways to help them do what they're doing better. And now we've got to stop focusing on that little micro world and start thinking about doing the same thing, but in a bigger world where we're thinking laterally all of the time, solving problems, but communication and keeping those communication lines going and working to common aims is going to be the key of doing this successfully. You know, not getting distracted and not getting put off by things that go wrong sometimes, and just focusing on the goal and communicating with each other all of the time. This is what we're trying to do. This is how we're trying to do it. What's the next thing we've got to do? Who else do we need to work with to make that happen? And growing it like a big sprawling network of communication and action to achieve these things that we need to do. Because we all know, right, that coming up is a really difficult time, and the system is going to need us all to work together in this way to make sure patient care and patient outcomes aren't negatively affected going forward.
Thanks, Michelle. Beautifully summarised. So we're at the end of the session. It's been a very short one, and it's one that we could continue talking about for hours, I'm sure. I think the key things that have come across, as was evident in that question, is collaboration is absolutely fundamental to getting adoption, and finding these new ways of working and looking critically at ourselves as well, as industry, and what we can be doing better. So I'm going to have to draw it to a close there. Sorry we didn't manage to get through everybody's questions, but there is obviously the rest of the conference you can explore. We've got plenty more sessions. There's also the networking area, and hopefully all of our speakers are happy to sort of network through Giant on there, and you've got all your profiles on there, so you can, if you want to speak to any of our panelists, you can find their details via there. So I just want to finish by saying a massive thank you to all our panelists today, and yeah, we look forward to welcoming everyone on the rest of the sessions.
Thanks everyone. Bye.
Thank you very much.
Bye.
Thanks everyone. Thanks, Chloe. Take care.